before I have my patients get up and do anything, I will ask them, do you feel safe doing this? If I had you stand here and close your eyes right now, do you think you would fall over? And if they say yes, then I'm going to document that I feel unsafe doing this part of the exam and it's not been done today for safety reasons. So that's a big part of anything before I assess them where I think they could be a fall risk for sure. Same with something with a patient who has a lot of vertigo. I'm going to be checking that. So you do have to think about that for patients of all ages. It's not just patients who look elderly or frail. You want to consider it for everyone. And comment on things like their mobility devices. So with this, as you mentioned, it is really getting creative, and you're going to do a lot of that sort of visual assessment and document what you're seeing, because it's amazing how much we can actually document just based on that visual. If someone's got a cane, then you want to know why they have the cane, and do you really want them up walking if they're there by themselves? So those are definitely some of the big safety issues. The other big safety issue is, what are the red flags? Like, when shouldn't you be assessing someone over video? When do you need to find a way for them to come in? So an example for a lot of the patients I see would be if I'm concerned that they have papilledema. So if I think they have papilledema, then I really want to find some way to get an in-person assessment. Luckily right now for those patients, if I'm really concerned, I can bring them in for fundus photos and OCTs. So that's my way of working around it. So each center is going to have to look at what their resources is and what their safe way of doing it. We also have some physicians here where for certain types of, let's say, a rapidly progressive weakness, they're going to come, they're actually going to bring the patient in and say, this is a case where I do want to see this patient in person. So there are things like that. And again, you'll have to look at what your resources are. Is your clinic open? What's your relationship with inpatient stuff? And do you feel safe sending this patient to an emergency room potentially laden with COVID-19? So all of those things you are going to have to think about. And it is a bit more complicated for sure.